Today I'm operating on a newborn who we performed an operation on about a week ago, who was born with a very small aorta and a very large hole in between the left and right side of her heart, which we closed. And she has had trouble having a normal heart rhythm, and so we're implanting a permanent pacemaker today.
Every year, about 40,000 children are born with a congenital heart defect. About 25% of them need some kind of invasive procedure in their first year of life. Just a few decades ago, that wasn't even an option. But according to Dr. Chen, thanks to advances in neonatal cardiology, about 90% of babies born with defects are surviving these operations and growing into adulthood.
The fact that they survive to be adults is actually remarkable to them every day. To them, it's the gift that they can't imagine that they were ever going to get.
How was school today?
Good. When she was just 2 months old, Amy Haybear was diagnosed with 2 congenital heart defects, and her parents were told to prepare for the worst. Today, the 38-year-old is the mother of a very active 7-year-old named Haley.
I don't think any of us thought that I would be 25. I mean, my mom and I just talked about it, like, I can't even believe I'm gonna be 40.
But now, survivors like Amy are presenting a whole new set of challenges for the medical profession. Cardiologists, who specialize in adult heart problems, things like clogged arteries and leaky valves, just aren't trained to treat congenital conditions. And that's leaving patients with few places to turn to for comprehensive care.
Like after I turned, I don't know, 18, 21, whatever, and I went to an adult cardiologist, and he basically was like, I was surprised, but once he clearly explained to me, he deals with heart attacks, clogged arteries, all the hearts he deals with for the most part have 4 chambers.
A healthy heart is a 2-sided pump with 4 chambers. On the right side, the right atrium and right ventricle work to pump oxygen-poor or blue blood through the pulmonary artery and into the lungs to pick up oxygen. This oxygen-rich red blood then flows back into the left side of the heart, where the left atrium and left ventricle work together to pump it through the aorta and into the rest of the body. But Amy's heart wasn't built that way. Amy was born with a hypoplastic left ventricle. It's severely underdeveloped, essentially leaving her with just 3 working chambers. She was also born with what's called transposition of the great arteries. Her pulmonary artery and aorta are connected to the wrong pumping chambers. Without surgeries to compensate for these defects, Amy would have died from low oxygen levels.
1 and 6 and divide it in half, and I get...
For most of her general heart care, Amy goes to a pediatric cardiologist. Only things got a little complicated 7 years ago when she developed an infection in one of her heart valves during her pregnancy. The valve was eventually replaced, and she was put on Coumadin, a blood thinner typically used to prevent heart attacks, strokes, and blood clots. But then she asked her pediatric cardiologist if he could monitor the prescription.
He said, I'm not comfortable monitoring it. I don't have any patients on Coumadin.
Dr. Chen, the surgeon who replaced Amy's infected valve, says patients like her need better options as they age. The American Heart Association estimates there are currently more than 1 million adults who are living with congenital heart disease. And that number is expected to grow as the success rate of pediatric heart surgery continues to improve.
We need to start training specialists now who can take care of the impending, tidal wave of patients that's coming our way. Because right now, I think we're probably very ill-equipped.
To answer the call, a new specialty called Adult Congenital Cardiology is being developed at a handful of hospitals and universities around the country. Programs like the Adult Congenital Heart Center at New York Presbyterian Hospital are for cross-training in both pediatric and adult cardiology. Doctors need about a decade of training to be board certified in both specialties.
There are very few of them around the United States, so it means that the vast majority of adults with congenital heart disease are really being managed primarily by adult cardiologists.
In the meantime, these centers are trying to meet patient needs by providing experts in both disciplines. That's what Amy does. She sees an adult cardiologist and a pediatric cardiologist too, an experience that can sometimes be a bit strange.
It's all, Disney and Ariel and everything and the little toys and stuff. Every once in a while, well, I've never seen an adult myself at the cardiologist, but I have seen a teenager. I mean, I've definitely have been in the room before when it was the person was 16, 17 kind of thing. but I don't know that I've ever seen anyone there like over 21, besides myself.
For the Wall Street Journal, this is Christina Tsuei in New York.